7:23. As more light is shed on the postpartum issues faced by many women after they give birth, researchers at some New York hospitals are taking a closer look at one complication that's often viewed as cosmetic. Here's New York Health reporter Aaron Phillips with the story.
After recovering from a C-section delivery, Sharon Phillips was anxious to get back to the gym. But when she was cleared to work out, she discovered she couldn't.
I went to the gym and I was like, I'm gonna do a Pilates class. And within the first 5 minutes, I had to leave. I could literally not do a sit-up. And not even a half a sit, nothing. I could not sit up at all.
Not getting answers from her doctors, Phillips discovered through internet searches she likely had Diastasis Recti, also called diastasis. It's when the abdominal wall separated during pregnancy fails to return back to normal.
Go ahead and lift.
Hospital for Special Surgery physiatrist Ellen Casey confirmed Phillips' self-diagnosis. Casey says an estimated 60 to 70% of postpartum women have diastasis. One symptom is a so-called tenting of the abs when you do a crunch and the dreaded mommy pooch. But it's not just cosmetic. It can cause back pain, constipation, incontinence, and even hernias.
The core, we know, is so key for stabilizing our spine, letting us do sports activities, maintaining, continence and all those things. And so if it separates, you lose the integrity of the core, which is so important.
You're feeling for the gully.
Teaming up with Leah Keller, the personal trainer behind Every Mother, Casey has launched a clinical study. It's the first randomized controlled trial on the topic, following on the heels of a retrospective study done at Weill Cornell Medicine that found certain exercises can actually close that gap in the abdominal wall without surgery.
Tighter.
So it might be that any core exercise is helpful, or it might be that specific core exercise is helpful, and that's really what we want to figure out. And they can actually have evidence-based strategies.
Phillips is seeing a reduction in her diastasis through her PT sessions.
I got better in a matter of weeks, and I'm still strengthening it, but the fact that I was immediately seeing results is incredible, so I think it's fantastic.
Aaron, mommy pooch is not a medical term, but people know what you're talking about.
Everyone knows about the mommy pooch because most women experience it after they have babies. Yeah.
So you downloaded this app yesterday?
Yes, because when I was interviewing Dr. Casey and she starts talking about the symptoms, like my face dropped. I did the story because I've heard of many women having diastasis. I have many friends with it, but I didn't think I had it. And then she started going through the symptoms where you can't necessarily activate your core, your muscles tent up, you're feeling weak down there, lower back pain. And I was like, oh my goodness, I think I have it. So I downloaded the app and I tested myself, and I definitely have a space there.
So how successful, not that you've started doing the exercises, but for those who have done them, how successful are the exercises?
They're pretty successful. The first study they did was at Weill Cornell Medicine, and there were about more than 60 women part of that study, and all of them saw a reduction of that gap. Now, not all of them lost all of their incontinence. Some of them still had a little bit of back pain, but everybody saw some improvement.
Is there, you would think there'd be standardized treatment.
No, there's no standardized treatment. There are physical therapists who specialize in pelvic floor sort of strengthening and core strengthening to help women in that area. Many times it's not covered by insurance, but if there was some sort of standardized procedure recognized by the national organizations like the American College of Gynecologists or something, we could start to see these sorts of services covered by insurance so women can easily get help. And it is as easy as downloading an app and doing targeted, slow, deliberate exercises every day to simply close up that gap and better support your core.
Tell me again the name of the app you used.
It's called Every Mother. Yeah.
Aaron, thank you. It's 7:27. The stories you need to know up next, including highlights from the New York 1 debate.